The use of face shields. Roque insists that there is a chain of command to be followed by local leaders.
Another way of looking at it is null and void po siya for being in violation of an existing executive policy decreed by the President himself, no, in the exercise of police powers.
The Health Department will present their recommendations on the matter to the IATF on Thursday. However, until then, the DOH is urging LGUs to wait for the IATF's final decision before implementing any policy.
The DOH and concerned citizens are worried that adults and children may be exposing themselves to COVID-19 by crowding and gathering after the downgraded alert levels. At the same time, Metro Manila mayors are considering to limit the use of face shields. How should government maintain public health protocols under a lowered alert level status? We discuss in this episode of The Chiefs. Welcome to The Chiefs. I'm Robbie Alampay. Joining us from Quezon City, Lucy Cruz Valdez of News 5. From Manila, Ami Pamintuan of the Philippine Star. And here in Mandaluyong with us in studio, Ed Lingao of One News. Chiefs, happy Monday.
Hello.
Monday.
Monday.
Medyo, Ami, medyo may bangga na naman ng Maynila at saka ang national government,
Oo nga eh. Mayor Isko is digging in eh. Sabi niya, he is authorized under the local government code na ipagbawal na yung, tanggalin na yung requirement for face shields.
And to a degree, he's right, because yung implementation ng policies niyan are through ordinances. The IATF cannot impose fines or anything like that without force of law or force of ordinance.
And to that point, there are other LGUs ahead of Manila na hindi naman din nila na, I think Iloilo, if I'm not mistaken.
And I think Cebu.
Oh,
Yes, Iloilo.
And Davao City.
diba? So yan yung mga, and then the Metro Manila Council, of course, is also leaning towards that. Hindi pa naman sila unilaterally imposing the
Hindi pa
way.
nagde-declare ng
diba? But they're
autonomy.
waiting for the official, but they're leaning towards that recommendation as well. So we might as well start that today's discussion on that. We begin tonight with MMDA General Manager, Attorney Romando Don Artes. Good evening, GM Artes.
Good evening to all of you.
Magandang gabi,
Good
sir.
evening.
GM, linawin lang po natin. So, right now, notwithstanding Manila acting on its own and unilaterally ngayon, bukas, until government says so, face shields pa rin ang mandato natin sa NCR.
Yes, yung resolution that was passed will recommend to the IATF that the face shield be required only in critical areas like hospitals, clinics, and where social distancing is not possible.
So that would include public transportation.
Yes, public transportation included.
Attorney, let me back up a bit. As far as processes are concerned, paano ho ba yung proseso nito? The IATF hands down a policy, and then what happens? Kanya-kanyang ordinansa yung mga LGU, or paano po?
It depends on the policy. In this particular case, just like yung ating face mask and face shield, mandated yan as part ng minimum protocol for health and safety as advised by DOH and approved by IATF. After that, yung LGUs normally ang nag-i-implement ng mga protocols na yun.
By that, sir, I mean, for example, pag may hinuli sa isang LGU na, wala kang face shield, ano yung pinapataw na kaparusahan? I suppose, ordinansa, kasi wala namang kaparusahang binibigay ng IATF.
Yes, ordinance. Pero may batas tayo regarding pandemic na merong kaukulang parusa. So, pwede rin naman nakasuhan under that particular law.
Sir, yung
If ever.
reporting of notifiable diseases, yun ho ba
Yes.
yun?
Yes.
I thought that was already disregarded by the DOJ. di ba? When they started, when they were arresting so many people for violations of the law on notifiable diseases, bumitaw na yung DOJ na parang that's not implementable anymore because it's too much of a stretch. Kaya I thought that you're relying na lang on ordinances by the LGUs.
Yes, basically, right now we're relying on ordinances for particular violation. Pero as directed by the President, hindi naman natin din strictly ini-enforce yung pagkaso or pag-penalize regarding violation. But rather, we just remind them and ask them to wear face mask and face shield instead.
So, sino po ngayon ang masusunod sa Manila? Kasi as of this evening, nag-issue na ng statement si Mayor Isko Moreno na tuloy pa rin daw at
Beginning today talaga.
Not the autonomy to impose that, well, to ease the restriction. Inis lang naman daw niya. Saka nandun pa rin naman daw sa mga PUP, sa mga hospitals nga. So, anong magpiprevail ngayon sa Maynila? Anong gagawin? Nalilitahin mo.
I'll rather not comment on that, Ms. Amy. I'll rather stick with the recommendation of the NMC for IATF to remove wearing a face shield as a mandatory requirement, except in critical areas.
Pero pwede bang maaresto yung mga nagba-violate? Sa Maynila, hindi violation. Sino masusunod doon kung may accosted by the police, for example, sabihin, bawal pa yan natanggalin yan Pwede ba silang i-accost? Pwede bang magreklamo yung tao kapag sinabi, nagba-violate ka?
I think DILG will be the proper agency to answer your question, Ms. Anne.
Kasi bukas
So when do we expect a decision on the part of IATF on your recommendation?
I think merong emergency meeting ang IATF DWG tomorrow. So I think it will be discussed.
So bukas pa, ano sa tingin nyo ang chances na makikerry ang record nyo? Kasi gusto na ng mga tao talaga.
At saka it's a recommendation from the Metro Manila Council, di ba?
Yes.
Normally naman yung mga recommendations ng Metro Manila Council ay pinakikinggan ng IATF. But it's a multi-department, multi-agency technical working group na maggagawa ng recommendation sa IATF. Then the IATF, again, composed of secretaries ng different departments, will decide whether or not the recommendations of the Metro Manila mayors will be followed.
Sir, pinag-usapan
Among
nga
the
namin kanina.
mayors,
Go ahead.
sino yung unanimous pa yung RECO to lift it already?
Hindi ko pa nakita yung latest tally, but as of last night, it was majority already voted for that recommendation. Hindi ko pa lang po nakita yung latest count ng mga mayors who signified their approval of the recommendation.
Ang pinag-usapan namin po kanina before we brought you in, maraming ibang syudad sa bansa na hindi na nag-implement ng face shield policy despite the IATF policy on face shields. Among others nabanggit Iloilo, Davao, and Cebu. Among others. So yun po actually, it boils down to this. It boils down to this. Paano kung sinabi ng IATF na hindi pwede? Kailangan nyo pa rin ipatupad ang face shield policy. Anong gagawin ng MMDA?
I think we leave it up to DILG as direct supervision over LGUs to whether or not to implement the said.
Sige, nagkagulo din po dun sa policy, medyo magulo na policy on minors, Para lang po malinaw, ano ba talaga ang pwedeng gawin ng mga bata ngayon? Within Metro Manila na lang. Sige, makakapasok ko sila sa malls. Saan sila makakapasok? Anon pwede nilang gawin doon? Pwede na ba maglaro sa mga internet cafes, yung mga minors, gano'n?
Yes, under the alert level 2 system, allowed na po sila lahat ng activities. So pwede na po sila mag-mall. Yun lang, we still have to follow yung minimum protocol for health and safety like face mask and face shield and in going to the mall. Tapos yung mga establishments naman po, kailangan pa rin po mag-follow na po strict na 50% dining or 50% capacity for indoors and 70% for outdoors.
So by minors, we're talking about 12 to 17 years old, ano?
17 and below. So, including children.
Even younger than 12 years old, pwede.
Yes, yes.
Okay. Including toddlers.
Yes.
Okay.
Sir, GM, we're already seeing, of course, the effect of, I mean, basically, this loosening of all restrictions. Dami na naglalabasan, traffic na. The last time you were here, in fact, sabi nyo nga, which practically, before it was like 7,000 short and we're practically back to pre-pandemic levels of traffic. I'll bring up a question from that time again. So, does that mean na babalik na? Should we be anticipating na babalik na ang coding sa mga main roads?
Yung number coding scheme po patuloy na pinag-aaralan. Pero sa directive po ni Chairman Abalos, mukhang hindi pa natin siya pwedeng ibalik dahil nga po ang ating pampublikong transportasyon ay hindi pa rin po normal. Right now, it's at 70%. And hindi pa po lahat ng ruta ay nabubuksan para sa mga iba't ibang sektor ng transportasyon at hindi pa po talaga normal yung biyahe ng ating mga jeeps and buses. So, in the meantime po siguro hindi pa po natin ipapalik.
So does that mean that I'm sure there's a lot of things, but among other things that we can be monitoring is hanggat hindi 100% ang public transport allowable, we can count on that na hindi rin babalik muna ang coding?
More likely po, pero as I've said, patuloy po yan inaaral ng ating Traffic Engineering Center. Pag talaga po sigurong sobra na ang sikip ng daloy ng trapiko, right now kasi it's still moving despite the volume. So we're closely monitoring.
Yung carousel, sir, ano ba yun? Permanent na yun?
As of this time, it's a DAOTR policy. I think it's working naman kasi mabilis ang biyahe ng buses. Unlike before na nata-traffic sila. Now, with a dedicated lane, medyo dire-diretso na yung pagtakbo ng mga buses. So, yung movement ng mga commuters using buses and MRT, mas mabilis na as compared before.
Pero ano na ba? Nanumbalik na rin ba yung bilang ng mga bus at bilang ng mga pasahero ng public transport for you to be able to say with a certain degree of certainty na yan na yun at hindi nahahaba pa mga pila at ganyan na rin kabilis talaga. Diba? Sigurado ba tayo na talagang makakatulong yan overall sa traffic? Kasi nag-improve hindi mo ba yung compared to pre-pandemic, mas mabilis na talaga yung travel time from, say, Monumento all the way to Pasay. No? But the question is, will it normalize to a point where kahit na lahat ng mga bus bumalik at mga pasahero manumbalik sa dati, mami-maintain ba yan just with a carousel?
I think pwede naman pong ma-maintain dahil nga po sa present na bilang, medyo sapat pa rin naman po except siguro pag rush hours, talagang maraming pasahero. Pero dahil mabilis po ang turnaround time ng ating mga buses dahil mas mabilis yung kanilang pag-ikot, pagbalik, masasabi naman po natin na effective pa rin siya and talagang kaya naman yan po i-cater yung mga pasahero as of this time.
Attorney, last time we had you here, nabanggit kasi ninyo na 7,000 cars lang yung difference between the pre-pandemic traffic and what we have right now. But we're only in November next month, of course, alam mo na, Pasko na yan at nagpubukas sa yung mga stores. I'm wondering lang if you're seeing Carmageddon coming back, especially since we're not yet having any coding in the near future.
So far, wala pa naman tayong nakikita na ganoon. Pero we expect kasi during Christmas season, nagpipick ang mga sasakyan at around 420 to 430,000 a day sa EDSA. So wala pa naman tayong ganoon. At yung situation na yun kasi is ang buses nasa kanan. So talagang maskip na maskip. So right now, even with the cars back, it's still at 20 plus kilometers per hour, which is more than double pa rin noong pre-pandemic level na 11 kilometers per hour. So I think even with the cars going back to pre-pandemic level, mas mabilis pa rin yung biyahe ng ating mga sasakyan.
Mr. Artes, nag-ease na kayo ng restrictions on children. What about sa elderly? Kasi may pinuntahan akong outdoor market over the weekend. Bawal yung mother ko, 65 and above, bawal eh. Meron pa bang ganung mga restrictions for the...
Meron pa rin po kasing mga mall-based or establishment-based restrictions, which is a business decision on their part, which we don't have control over. So, depende pa rin po sa pupuntahan lugar. Kasi nga po, as you have experienced, medyo, minsan may mga malls na mas stricter kaysa sa iba. So, we really cannot regulate yung lahat ng mga malls and establishments.
So the malls can keep out certain sectors pa rin. If they want to keep out the elderly and very young children, wala kayo doon, yung private sector, hindi nyo pakikialaman.
Yes, I think because that's a private establishment.
Attorney, yung bus carousel system na pag-usapan natin, it really does seem to be working. Unfortunately, limited pa yung capacity. But apart from waiting for capacity to be allowed to go up, what else is being done for our bus riding public?
Actually, ang DOTR ang may program ng EDSA Bus Carousel. I understand that magdadagdag pa sila ng biyahe or ng buses to cater to the bus carousel. And I think they will come up with a solution for that soon. Kasi inaaral pa rin nila itong epekto ng 70% capacity. At siguro kung mas bababa pa ang level natin, alert level, siguro baka pwede na nilang gawing 100%.
In the meantime, ito, attorney,
Ano
ano to
kaya
parang...
yung mga,
sorry.
ano kaya yung mga FX, attorney?
As I recall, hindi pa yata siya kasama sa ino-open. So, pero I think soon papayagan na rin siguro ng DOTR. At for sure, inaaral nila sa ngayon ang pagbabalik ng mga FX and UB Express.
Kasi yung mga bata ngayon na sumasama sa paghahabol sa mga jeep pag sumasakay, and you just can't help but worry for the children, kahit
Yes,
na kasama nila mga magulang nila. Yeah.
At the last IATF meeting po that I attended, it was discussed by Secretary Chu na dapat balanse yung pagbubukas ng economy at yung pagbubukas ng transport system. Na it should go hand in hand para po talagang ma-revive yung economy. So, and nandun po sa meeting na yun ang mga representative ng DOTR na alam ko po na inaaral na po nila ang talagang pag-normalize ng public transport.
GM, the last time we were trying to reconcile yung kanina, banggit natin. On the one hand, practically, let's assume, back to normal na yung volume of private cars and private vehicles along EDSA. And yet, the reality is committed theoretically kasi na-dedicate na as a bus lane yung sa loob, meron ka pang bicycle lane dito sa kanan, but you also said na pwedeng mas mabilis yung daloy precisely because dito sa kanan wala na, pati yung mga ibabaw, mga service roads, pwede nang gamitin, no? And that's really true. My experience is pagka sa service road ka, whether ibabaw yun or ilalim, mas mabilis na talaga. But you still see a lot of people, I guess out of habit, out of old fears, talagang nag-iimbudo pa rin papunta sa ilalim. Gusto ko lang tanungin for the record, permanent na po yan? Pwede na po namin gamitin yung ibabaw, kampante na kami. If I stay on the right, for example, on EDSA, dire-diretso yan, walang biglang sorpresa na, hindi na ulit pwede.
In the meantime, I think it's it will be the policy. I mean, open po yan sa ngayon unless ipalitan po ng DOTR yung scheme. But since as you've said, it's working, so hindi na po siguro muna natin gagalawin yan. Or maaari pa pong improve, pero in the meantime, we'll keep it at that.
So for the foreseeable future, I mean, because this is a tip for the driving public.
Yes,
no? But-
I think in the foreseeable future, it will stay.
Okay.
Ah,
Okay.
Only the last time you were with us, you were telling us about the entry sa Metro Manila Film Festival. You said you will announce by mid-November. Baka naman ngayon medyo maaga-aga, meron na kayong line-up. No?
I think it will be announced on the 12th of November. Binubio po yan ng ating mga selection committee. Ang nag-submit po ay 19 entries na finished films. So I can say na based on the list and based on the genre and the artists and directors, we have a very, very decent entries to choose from. So out of the 19 entries, we'll choose 8. I think the announcement will be on November 12.
Anong mga special preparations? November 10 daw, meron ng ilang cinemas that will be opening in Metro Manila. Meron bang special arrangements kayo?
Yes, ang DTI naman po ay impose certain restrictions. In fact, I think si Chairman Abalos ay may invitasyon sa isang mall. Ipapakita po nila yung kanilang sistema, yung mga health protocols na kanilang idinagdag like filters, sitting arrangements, temperature getting. Lahat po yan ay ipakikita raw po kay Chairman Abalos, kasama po yung mayor ng LGU. I think it's in Taguig, si Mayor Lino Cayetano. Papakita po ng isang mall sa Taguig yung kanilang preparations at yung kanilang system para po ma-ensure na ligtas yung panonood po ng sine starting November 10.
But Jim, just very quickly, and para lang malinaw, the preparations we presume will extend outside of the cinemas, di ba? It's one thing for them to show, nag-install kami nito, we will limit the seating, but the Film Fest being one of the most awaited festivals every year, baka naman, and we've seen that not just in movies and theater, we've seen it even in masses and so on. With some confusion, people will come, and the problem is actually more outside and lining up. I mean, we'd like to think kasama yon sa lahat ng ide-demo at ipapakita and the accountability.
Yes, I think nag-meet naman po kami sa Cinema Exhibitors Association of the Philippines, yung pong may asosasyon ng may-ari ng mga sinihan. At meron naman po sila mga pinagbatayan na mga proseso. Pinag-aralan po nila yung process ng mga naunang bansa na nagbukas ng sinihan. So I think they're adapting to that. At yan naman po ay pinresent ng mga sinihan sa IATF. At ipakita po nila na meron silang paghahanda, hindi lamang sa loob ng sinihan, pati po yung sa labas. So, ang imo-monitor po siguro natin is yung strict implementation nitong mga protocols na inilatag nila sa IATF.
Okay, Attorney, maraming salamat po. We've been speaking with MMDA General Manager Attorney Don Artes.
Ingat, sir. Thank you po.
Thank you.
Salamat po.
Salamat po.
Magandang gabi po sa inyo.
Please stay with us. The Chiefs will be right back.
Welcome back to the Chiefs here on One News, and now joining us is pediatric infectious diseases expert Dr. Anna ONG-LIM. She is also a member of the DOH Technical Advisory Group. Doc Anna, welcome back. It's good to have you back.
Good evening, Doc
Good evening,
Anna.
Doc.
Medyo long time no see. Doc, well, we bring you back kasi, let me start off with this. The big debate again over face shields. I'm sure you've heard the back and forth, and we've been hearing it for a year, but now it's back again with a vengeance. Manila is declaring that it is not requiring face shields anymore. The MMC, the council, is recommending that it not be imposed. You have Davao, Iloilo, and Cebu also saying the same thing, and yet we're still waiting for IATF. What should we believe?
Kala ko we were going to talk about the PediaVax first.
Well,
Yung mahirap pala pinag-usapan natin kaagad.
We'll also get there.
Well, ganito. I understand kasi that there are certain guidelines or rules that IATF has the prerogative to impose. And I think these restrictions on PPE is the prerogative of IATF. So I think that's where they're coming from. I don't think it's a question about whether the face shield should or should not be allowed. It's just a decision-making process that they're objecting to, or that there's an issue about.
Yes, Doc. But we were wondering about your medical
medically.
expertise. Yes, sir. Yes,
Yeah.
ma'am. Your medical expertise
Well,
po.
ever since naman kasi, the view about the face shields is that it provides an additional layer of protection, particularly to prevent entry of droplets into the eyes. Kasi it's a portal of entry talaga. Now, syempre, when we talk about using PPEs, you balance the risk of transmission, where it enters, and the rate of transmission. And one of the things that has really changed in the past few weeks is the fact that we are on the downturn in terms of our cases. We have decreased our alert levels, and so it becomes appropriate again to re-examine whether all of the PPEs need to be in place, some of the PPEs need to be in place, or we can modify.
Sige, Doc, pediatric vaccination naman.
Salamat.
Nagbabalak na daw ang government to, studying the vaccination of children below 12. No? Ano pong mga, what should we watch out for sa ganong ano? And how different is that from vaccinating minors 12 to 17?
The EUAs for the 5 to 11 age range is a fairly new announcement, even in Western countries where they've already started their vaccination since early this year. So, natural na talaga we will go to that age range, no? Kasi we want to be able to cover as much of the population as possible. And typically, whatever is accepted globally is also upheld here in the Philippines. So if the manufacturer applies for an EUA for 5 to 11 in the Philippines, then that will be studied. Pero siguro, for the general information of the public, one big difference really is that the dosing regimen or the dosing formulation is different. Hindi pwedeng magpabakuna ng pang-adult na vaccine yung below 12 kasi mas iba yung dosing na ginagamit sa bata.
Are you expecting high acceptance among parents considering yung resistance to certain vaccines, wag na natin banggitin, but even the COVID vaccines, mataas yung vaccine hesitancy up to now, right? Outside Metro Manila. How are you going to persuade parents na pabaksinate nyo yung mga
For the
anak
kids.
niyo? Yeah.
Well, I think we have to really focus on educating parents and guardians about the pros and cons of the vaccines and the risks versus benefits. No, I think everybody naman is coming from the perspective that we all just want to be careful.
Yeah.
And syempre bilang guardian, bilang parent, the interest of your child is foremost. So I hope that as we provide them with the information, they can make the correct decisions.
In the meantime, speaking of educating parents on how to manage the risk and benefits, never mind vaccines, what do you tell them now that loosened ang restrictions for minors?
I think we all have to be aware of the fact that the virus hasn't gone away. It will continue to target those who are vulnerable, in this case, those who are unvaccinated. So if we choose to bring kids out, we still have to be able to make sure that as much of the MPHS, as much of the apat dapat can be complied with. So pipili tayo ng lugar kung saan tayo pupunta. Pipiliin natin kung maganda ba yung air quality ng lugar na yon. Pwede ba tayong makapag-distance ng maayos? Masusuot ba natin ng maayos yung mask and shield natin and so on.
Of the infinite scenarios that you can imagine kids getting into, kasi ang dami, di ba? Parang public transport, malls, restaurants,
Playgrounds.
indoor dining, al fresco, now even gaming, going back to computer gaming centers, which will give you more the most fits?
Siguro kung I think many of us naman have imbibed the habit already of using our PPEs properly. Medyo nag-hesitate ako doon kasi marami pa rin ako nakikitang hindi tama ang suot. Pero sige, granted na
Actually,
lang.
ma'am, marami pa rin talaga yung nakababa
Oo
yung
nga
mga face
pero,
mask.
pero I think wala naman yatang nangangahas ngayon na lumabas na wala man lang face mask. Kahit na medyo alanganin yung suot, kahit papano, I don't think we're used to leaving our homes now without face mask. So kahit papano, we can do that. I think the only other thing that would I would remind kids about and their families is be conscious about air quality kasi hindi siya top of mind sa atin eh.
Yeah. And what about ayun na nga, yung face shield. I mean, pati ba yung mga bata pag face shield? Assuming na i-insist pa rin ng IATF na kailangan pa rin ng face shield. I'm just trying to find some logic in this protocol, no? Because there's so much debate over whether face shields work or not, and yet, now we're allowing the kids to go to crowded places. So parang feeling ko, halimbawa yun, parang aren't we rendering them, going by the logic, more vulnerable now? I mean, they're unvaccinated. I don't think that there are face shields tailored for kids, especially 2-year-olds or 3, whatever. No, aren't we subjecting them to, the dangers of this virus if we go along with the IATF warnings on the virus being still out there? Parang hindi ko makita kasi yung consistency sa decisions on the protocols. So, yeah.
Well, siguro the decision making is not, it takes into consideration a lot of other factors. But siguro if we were just to talk about the science, di ba? Siguro the easiest way to understand this is in the healthcare setting, even before COVID came along, eye protection was necessary for certain procedures because we knew that you could get virus or bacteria and infect yourself as a healthcare worker if you didn't have the proper eye protection. So, etong COVID actually just adapted those processes. And so, whatever IATF decides for the general public, the science will still support the fact that if you have this additional layer of protection, it's going to help you with avoiding infection. Hindi magbabago yung na yun. Hindi magbabago yung reality na yun, di ba?
Yeah, kaya nga. So will we let the kids wear face shields?
Pinapayagan naman sila. Pinapayagan naman sila.
Hindi sa pinapayagan eh. Kunyari, you make them play in the arcades, but they have to wear their face shields and that's supposed to be additional protection for them. I mean, is that practical that we even allow them into the gaming arcades? And yet we recommend to wear your face shield.
So I can get where you're coming from. Parang if it's safe enough for you to be there, why are you still being... Yes,
exactly.
Tama naman yun.
And then require them to wear a face shield. That's
correct.
So weird, isn't it?
Correct. That's why it's being discussed. Diba? Parang to make it consistent. Kung sinasabi natin na safe enough na magtago ka dyan sa kulob na lugar, di dapat pwede ka nang walang face shield. At lalo, baka pwedeng wala ka na ring mask.
Yeah.
So dapat ganun nga.
Not only that, I mean, this doesn't add anything except just another example. But I remember early on in the discussions, Hindi pa rin natin pinapayagan magpunta sa eskwelahan, pero hinahayaan natin magpunta sa mga mall.
Exactly.
Yeah.
Exactly. So all of that is, maybe I would say it's being aligned. Kasi nga syempre, di ba, lahat naman tayo naintindihan natin to, lalo na yung konsepto na why would you allow kids to engage in leisure activities and restrict them from going to class? So dapat, to make it consistent, dapat as you allow or as you say that there's less transmission, therefore you're allowed to engage in leisure, di dapat mas lalong pumapasok ka sa eskwelahan.
Yes, ma'am. Ma'am, still talking about the science of it, of course, we do acknowledge that it is an additional barrier. The face shields are an additional barrier against droplets of COVID-19. Pero scientifically po, pareho lang ba yung likelihood of getting infected, whether it's through the eyes or through the nose or through the mouth? Considering that the eyes, the nose and the mouth are gateways for your respiratory system.
Right.
Whereas your eyes, I understand, dadampan ng mucous membranes yan and so on down the line. So scientifically po, are they all equal?
Theoretically, dapat mas may risk of getting into the respiratory pathway as you mentioned. No? Kasi meron siyang tinatawag na receptors kung saan swak na swak dumikit yung virus eh. So nandoon yan sa lining ng respiratory pathway. Pero kasi nakikita rin natin na for in certain instances, pwede talagang dumaan sa mata. No? So pati yun pinoproteksyonan natin.
Paano kapag nag-pilot na yung mga face-to-face classes, medyo marami na yung schools na identified. Ano yung i-recommend yung protocols? Will the children have to wear face shield?
Ako na-imagine ko nga yun when we were still discussing this, we really need to have better guidance kasi lalo na for kids who are visually impaired, challenge talagang magsuot ng shield. No? So siguro kung iisipin natin in terms of consistency, sino ba yung pinapayagan nating mag face-to-face? Di ba nga alert level 2 pataas or pababa actually? So hindi nga pa parang ang pinag-uusapan ngayon is kailangan pa ba ng face shield ngayon nasa alert level 2 tayo? So you would expect na pag pinayagan mo ng face-to-face, dapat mas may revision ka rin dun sa mga settings kung saan mo dapat i-impose yung face shield at kung saan pwedeng hindi siya gamitin. Or kung ano ang pwedeng alternatives kung talagang sinasabi natin na kailangan pa ng eye protection.
Now, on the other side of this, in the meantime, LGUs are already recommending against it. Some LGUs are already unilaterally taking off face shields. Does that necessarily mean that we're expecting a higher risk for the public?
Mahirap sigurong sabihin kasi we're doing this in the context where the transmission rates are relatively lower.
Yes.
So, like maybe a couple of weeks from now, if we say, hindi naman pala dumami kahit tinanggal natin yung face shield How do we know? It's because tinanggal yung face shield or dahil talagang pababa yung kaso. Medyo mahirap talaga. But siguro, parang what I keep saying is that in the healthcare setting, we would still use eye protection. Let's just use that terminology because we realize that it's an additional layer. So, kung may pakinabang yan sa healthcare workers, bilang civilian, maybe outside of the healthcare setting, wouldn't you also want to take advantage of that? Para kung hindi naman inoobliga, pero available naman yan sa'yo, may access ka naman, bakit naman hindi, di ba?
Kung mag-sunglasses, doctor, will it help? Kasi...
sa loob ng sinihan, ha? Sa loob ng sinihan.
Droplets lang siya, di ba?
Yeah.
For droplets.
Yeah.
So kung at saka mas madaling huminga kung hindi.
Oo nga.
Diba, pwede ba yon?
Kasi siguro if we were to define eye protection from the very technical perspective, ang gusto talaga dapat dyan medyo may konting seal Oo. So technically yung mga glasses hindi yan considered as
Hindi pwede.
hindi ka papayagan sa hindi ka papayagan sa COVID ward na salamin lang ang ginagamit mo. Siguro yun yung kailangan maintindihan.
Mas mayroon pang nakagagas, pwede ka mag-swimming nun. Bukas si Ami pupunta sa port area and bibili ng goggles.
Ganon.
Okay. Are we? Do you have another? Okay, sorry. Doc, what are we expecting in the meantime in the hospitals? What are you seeing at the level of the hospitals? We know that the numbers are going down. We've had weeks of doctors saying we don't feel it. Do you feel it now?
Siguro from the pediatric perspective, I would say yes. And it's quite encouraging, at least from the pediatric perspective. Maaring yung sinasabi na we don't feel it kasi yung mga laman ng ICU ngayon, parang I looked at the occupancy rate, it's about 44-43%. And kasi ito pa rin yung mga natira from the peak of the surge. Typically, it will take 2 to 3 weeks for people in the ICU to recover, or unfortunately, they will pass away. So, ito yung tail end ng marami.
And there seems to be, well, I was in a hospital 2 days ago for my checkup, no? And there seem to me to be so many others now lining up for much needed lab tests and consultations. Are you seeing people now coming, I mean, in droves? Because the hospital I went to, ganun dami. As in, naubusan pa ako ng, I mean, I needed to sign up for a halter. But wala na, ubus na, no? Yeah.
Yung mga optional procedures, is that what you call
Right.
that?
Yes, yeah.
Actually, siguro if I can just share yung experience namin in pediatrics nga. Nung nag-surge kasi, marami talagang mga kaso ng bata. And we would have to, there were some instances where we couldn't really accept any more of the transfers coming into PGH because we didn't have the space. So we expanded our capacity to double. And then in the meantime, we had to sacrifice the capacity of our general wards. Ngayon, baliktad na. No? We're able to manage with the minimum capacity in COVID. We've had to expand the general ward capacity. And ganun lang kasi kami dahil we're working with the same complement of people. Di naman dumami yung tao namin.
Yeah.
So we just reassign everybody so that we can provide the service that's needed. And more people are requiring non-COVID services from us now.
And Doc, we've spoken with some doctors who said the same thing. No? Na ngayon, for whatever reason, people may have been afraid to visit their doctors and hospitals before, but let's take down to pediatrics. Over the past 2 years, are there things that we may have been neglecting to do with our kids? Are there things na medyo dahil nag-COVID, we have a lot more kids due for a lot more things?
Yeah. So thanks for bringing that up because since everybody's attention has been diverted to COVID and rightly so, syempre yung mga well-child visits have been put aside. And now that we are talking about resuming face-to-face classes, allowing kids greater mobility, then ito na naman yung kinatatakot natin na yung mga vaccine-preventable diseases na maaring napabayaan ng panahon ng surge or ng lockdowns, yan naman ang kakalat kasi magkukumpul-kumpul na ulit yung mga bata. So, I think it's high time for people to start thinking about what catch-up doses they need. And also, a lot of other illnesses like nagkakaroon ng, there are people who are malnourished, no? Both over and undernourished, that's also a problem. And of course, yung sinasabi natin social-emotional development ng mga bata talagang naapektuhan.
Doc, tuhuin ko na rin, kasi there's a proposal from the DALG for a no bakuna, no ayuda policy. I'm sure you've heard about it. Lumabas lang ng weekend eh. Kung hindi magpabakuna, baka i-withhold ang portion ng kanyang 4Ps for the beneficiaries, for the regular beneficiaries. Your thoughts on this?
As an infectious disease specialist kasi, I've seen too many patients get sick, get complicated illness, or die from vaccine-preventable diseases. And siguro kung wala ng ibang consideration kung hindi kailangan ba o hindi, syempre sasabihin ko, oo, kailangan yan. Kung pwede sanang i-mandate, mas gusto kong minamandate. Pero alam naman natin, ang usapin ng bakuna, it's not that simple. There's a lot of personal belief and personal choice that comes into that. And I think, siguro hanggat sa kaya nating kausapin yung tao, ipaliwanag sa kanya, address yung mga concerns, baka mas maigi pa rin na ganun yung approach before we talk about mandating anything.
Pero ma'am, dun sa sa 4-piece law, I forget what section there's a provision in the 4-piece law that requires vaccinations for beneficiaries from 0 to 5, yung nga lang, from 0 to 5 years old. As well, requirement for deworming twice a year for those from 5 to 18 years old. So may ganung aspect yung 4-piece na may requirements for certain medical services. Otherwise, you won't get the benefits. I don't know lang if it can be
not the whole benefit.
Not the whole benefit.
Just 750 pesos.
Yeah.
Yes.
So I was wondering lang if that's a window for, is that some sort of a window for implementing that kind of a proposal?
Could be, no? Kasi I think those provisions were written in because they're basic health services. And perhaps the thinking there is how will you maximize naman the benefit of the assistance if your health is compromised, no? But syempre, kung may mga ganung klaseng precedents, then pwede rin naman sigurong gamitin yan as a window. But again, I think people really just respond better when we talk to them and reason it out and provide them with an opportunity to agree.
Dok, ano na nga ba yung mga basic bakuna for kids? Can we be reminded again? Because nakakalimutan na natin sa tagal natin na sa pandemic. No?
Yes.
I think TB is there, no? In
Yes.
the DPT, diba?
Yes. So we provide we provide vaccines against TB and hepatitis B at birth, no, as soon as a child is delivered. And that's actually the one that has been kept up kasi pagka pinanganak ka sa facility, ibibigay yun. Ang sumunod doon, you need 3 doses of DPT and then you need to complete the remaining 2 doses of the hepatitis B. In most of the country, we already have pneumococcal vaccine as part of the program. That's 3 doses as well. And then 2 doses of measles rubella vaccine. It's a very simple regimen. Hindi challenging to catch up. Ang kailangan ng gawin ng mga magulang is pumunta sa mga center kasi libre naman yan lahat.
Yeah, but do we have an estimate
from
on
ages what? 0 to what?
0 to
11,
1.
Is it?
0 to 1. So
within
under
1
12 years.
year. Oh, I
Yes,
see. Okay.
We call it a fully immunized child at the age of 1 year if they've been able to receive everything.
Yeah. When we say catch up, we're talking about at the level of the family, diba? And at the level of the child. But do we have a number of, in terms of our society, what percentage of our population needs to catch up on their regimens?
Malaki. We ended last year with an accomplishment of about 60-something% lang. So, ang daming naiwan last year. So, it's really a task that the DOH is also focusing on. They're engaging with the LGUs and the private sector to try to see how we can ramp up the campaign. Anticipating nga na magsisibalik na yung mga bata sa school at marami sa kanila baka hindi pa bakunado.
Yeah, I was going to ask about yung back to school na eh. Other than always reminding them, minimum health protocols helps a lot. Other than that, on the part of the schools, what would you remind and want to see in the schools before we can really say, okay, that gives us the confidence na baka pwede na tayo?
I think we need to be able to set up a contact tracing system within the school community. Kasi ano ba worst case scenario na pwedeng mangyari sa isang cluster or rather sa isang closed setting na yan? Kung may magkasakit ng isang bata or ma-identify na positive, syempre matataranta hindi lang yung administration, hindi lang yung parents, pati yung community kasi biglang pwedeng kumalat, di ba? So kung ahead of time na-identify na natin na ito ang ating steps pag nagagawin, pagka may mangyaring ganitong situation, and that is oriented well to all of the parents and the participants in the program, that provides a measure of confidence for everybody na kaya natin i-handle itong worst case scenario.
Yeah, that's additional work para sa mga masipag mag-Viber group ng mga parents sa mga
yes.
schools, di ba? I mean, but
Actually,
that's
yun ang
not to
pwede nilang
that's not to
itulong.
denigrate it, di ba? The Viber groups are there, the social media groups are there. That could be something I
Yeah.
guess that you could activate for that.
Right. Actually, yung mga napiling mag-participate sa face-to-face, malaki yung role ng parents and community in terms of engagement to make sure that they all understand what's required. Kasi yung palang pagpasok sa school, kunwari na nanggaling ka sa isang household na may sakit, paano ngayon yon? Siyempre, magpapaalam ka ngayon kay teacher na absent po ako today kasi may nagkasakit sa bahay namin. Ano ngayon ang obligasyon ng estudyante? Paano ka tuturuan kung kasama ka dapat sa pool na humaharap? Maraming mga maliliit na detalye na kailangan asikasuhin.
In the meantime, nag-umpisa na yung pediatric vaccination. Do you already have some data on the reaction of parents? Mataas ba yung vaccine hesitancy?
I've been monitoring the reports coming from the different hospitals when we piloted, no? And that one was really quite encouraging. And I guess the understanding there is naintindihan ng mga parents na high risk yung kanilang mga anak na may comorbidity, therefore, kailangan bakunahan. Pero nung mga panahon na yun, na ni-roll out or sinimula ng roll out sa may comorbidity, marami ring parents ng normal kids ang tinatanong, kailan kami? Kailan yung mga anak namin? So meron din namang maganda rin naman ang acceptance. Although I have to say, meron din mga nagtatanong, kailangan ba talaga yan? Di ba dapat tayo maghintay? So we need to engage. We need to explain what this is all about.
Are we similar to that question? Are we seeing the old problem also of being selective with the brand?
Tinatanong din yon, no? Kaso kasi for this pediatric rollout, there are actually only 2 vaccines that are available for kids with EUAs. And in the public program, there's only 1 that we can give kasi wala namang masyadong consistent supply ng isang brand. So walang masyadong pinagpipilian.
Okay. Dr. Ana ONG-LIM, maraming salamat po.
Thank you.
Thanks, Doc.
Ingat, Doc.
Thank you.
That's all for this edition of The Chiefs. We hope what was discussed here will keep the conversation going. Before we go, a reminder to our viewers, mask on, wash hands, stay safe, Philippines. I'm Robbie Alampay.
I'm Ami Paminton of the Philippine Star.
I'm Lucy Cruz Valdez, News 5.
I'm Ed Lingao, and we are One News.